tears up our constitutional rights. This law requires you to enroll in a one-size-fits-all health plan, whether you want to or not, whether you can afford it or not. It gives the IRS broad new powers to track you down and penalize you if you don't comply. Nothing in the United States Constitution permits this. In fact, those 28 beautiful words in the 10th Amendment expressly prohibit it. Worse even, for the first time in history, the federal government claims the authority to dictate how doctors treat privately insured patients. That means even if you're an Aetna or Cigna or one of those other brand name health plans, the government is still in control of your care. The law says that insurers can pay only those doctors who follow whatever dictates the Secretary of Health and Human Services imposes in the name of quality. Well, that covers everything in medicine. Whether your doctor uses a stent when you have heart problems, whether your OBGYN performs a cesarean section. The law says all your medical treatments have to be entered into that national electronic database. The federal government is going to monitor your doctor's decisions, and your doctor is going to be forced to choose between doing what's right for you and avoiding a government penalty. In addition, the president has claimed that he's solving the problem of the uninsured by making health insurance affordable. That's not how he did it. This law enrolls 18 million more people in Medicaid, doubling the size of the Medicaid program. It's welfare reform in reverse. And how are they paying for it? Well, there are $500 billion in new taxes over the next decade in this law. And now they're talking about an additional tax, the VAT tax, the Vanishing America tax, right? And in addition, that's what they should call it. Don't call it the value-added tax. That sounds like something good. But in addition, the $410 billion in new Medicaid benefits are being paid for by slashing future funding for Medicare by $575 billion over the next decade, just when 30% more people are going to be enrolled in Medicare as the baby boomers turn 65. Those numbers don't add up. It's going to mean fewer knee replacements, fewer hip replacements, fewer bypass surgeries, fewer angioplasties, fewer cataract operations. Those are the 5 procedures that have transformed the experience of aging. At one time, older people used to be trapped in wheelchairs with crippling arthritis, or they'd be stuck in a nursing home because their arteries were clogged and they were out of breath and couldn't walk. But now older people can enjoy their later years being active, having grandchildren, traveling. Obamacare is going to undo that progress. And the baby boomers who are just entering Medicare are going to get much less care than seniors currently get. In summary, this law lowers your standard of care, it puts government in charge of your care, and it takes away something as precious as life itself, your liberty. To halt this attack, we're moving to 2 new battlegrounds, the U.S. courts and the fall elections. 26 states have already filed constitutional challenges against this law. 26 states. But New York isn't one of them. Even though New York is hit harder by this law than any other state. Where is Andrew Cuomo? He's hiding. Where are our 2 U.S. senators, Gillibrand and Schumer? They are kowtowing to the president instead of standing up for our freedoms. My organization, Defend Your Healthcare, is working with candidates all across the state and this nation because we're going to take back Congress this fall. We're going to defund this law. We're going to defund it this year, and 2 years from now, we're going to repeal it. That's right.
That's it.
The White House has launched a 50-state PR campaign to convince the people that the law passed against their will is really in their interest. We cannot falter now. With the U.S. Constitution on our side and the hearts and minds of the people with us, freedom will prevail. We can help the uninsured. What Congress should have done is to take this 2,700-page law and put it in the paper shredder and give us a 20-page bill in plain, honest English. Honest English, not giving everybody the runaround. A 20-page bill that members of Congress could actually read before they vote on it. 20 pages. That ought to be enough. The framers of the Constitution established the entire federal government in just 18 pages. And after all, with just 20 pages, they can't slip in those exemptions for members of Congress. They can't slip in that pork barrel spending. They can't slip in those bribes for the members of Congress who are a little reluctant to take away our freedoms. 20 pages to fix what's broken, those problems with insurance, fix what's broken, and leave the rest alone. Or let me say it differently, leave the best alone, because if you're seriously ill, the best place to be is in the United States. That's right. A woman diagnosed with breast cancer in the United States has over a 90% chance of surviving it. In Europe, her chances are less than 80%. That means she's twice as likely to die. A man diagnosed with prostate cancer in the U.S. has a 99.5% chance of surviving it. It's not a death sentence here. But in Europe, his chances are less than 79%. 1 out of every 4 men diagnosed with prostate cancer in Europe dies from it. And if someone in your family has an incurable illness, something we currently call incurable, this is the nation of hope. This is where the cures are developed. Since 1950, the United States has won more Nobel Prizes in medicine and physiology than the entire rest of the world combined. And that's why this is the fight of our lifetimes. It's a fight we have to win. Thank you.
That's it.